Hello, good morning. I am so lucky to have Dr. Tony Hampton from my hometown, Chicago.
Chicago.
And more amazing, he is low carb.
That's right.
Low carb doctor who promotes the low carb lifestyle to heal the body. So I labeled this fantastic live stream 10 reasons to do low carb, and I would like to hear your opinion on that.
Absolutely. First of all, excited that you're with me on this live stream, joining you on your channel. I've streamed it to mine as well. So those who are on my channel, subscribe to Alia's channel. And for those on Alia's channel, consider Dr. H in the house, Chicago. You don't have to be from our Bears are horrible. So don't
Oh
don't
man, the Bears.
don't do it for the
Oh
Bears. I know
no.
it's horrible. It's horrible, but
Packers.
we'll talk about that another day. But I'm really happy and thankful to everybody who actually takes time on a Sunday to join us. And so, just for those who don't know me, family doctor, obesity doctor, nutrition and masters in functional medicine, and all that good stuff. Big fan of lifestyle changes. We're good, and I really love sharing messages of healing. I just squeeze that out of my busy life because I think it's important. And why is it important? Because so many people think low carb, keto, and carnivore are fad diets. They think it's you just do it for a little bit. It's not safe to do long term. But just know that the American Heart Association, American Diabetes Association, the Society of Clinical Endocrinology all endorse that diet. So if your doctor doesn't know that, make sure they know that, because they're afraid of a diet that Dr. Eric Westman at Duke has been using since 2002 to heal people and reverse diseases like diabetes and hypertension. And those people are still with us. They're still thriving. They haven't had heart attacks and stroke. And so I just want to make sure we give you permission to do that. And guess what? These diets are not just for weight loss. This is and so we want to just talk about, what comes to mind for me. So I'm going to jot these down as we talk about it. The first thing I like about low carb, keto, or carnivore is it reduces your appetite. So one thing that's really cool about this dietary pattern is that it really makes the most difficult thing you may deal with, which is your appetite, you're good. And on the weekends, I may eat breakfast, but many days I just eat lunch and dinner. And many days I can just eat once a day because I don't get hungry. So for those who have struggled with appetite issues, you can absolutely reduce your hunger by eating this way. Another thing I like about this that's beneficial is you may have heard about metabolic syndrome. You may have heard that one of the measures of poor metabolic health is a large belly. This dietary pattern, a lot of fat loss and weight loss that you get, it starts right there in your belly. So if you're interested in losing your belly, but more importantly, not being metabolically unhealthy, I think it's important that this dietary pattern is perfect for that. It'll help you lose weight around your organs, which is a much greater risk for disease than losing it in your thighs, for example. Now,
We'll talk about that.
amen, amen. I triggered you. I triggered you. Didn't mean to trigger you. So now that's two. So we got the hunger. We got I'm gonna have to write this down so I can stay in order. We have the abdominal circumference, which is your belly. The third thing I want to talk about is your triglycerides, because your triglycerides will go down, and that's the triglycerides are like the fat molecules circulating in your blood. And truth be told, you may want fat on your hips depending on what neighborhood you're from. Trust me, in the neighborhood I grew up in, you did want that. Trust me. But having said that, the triglycerides are in your blood, and that fat in your blood can then increase your risk for heart disease. In fact, it's clear that your cholesterol and LDL particles, which we focus on, are not as predictive of a future heart attack than your triglycerides. So we want to lower that. And guess what? The low carb diet does a great job of lowering that. The fourth thing is the HDL, which is, we talk about the triglycerides to HDL ratio. You want that to be less than 2. Your HDL, as you know, is considered the good cholesterol, and clearly a great predictor of metabolic health is having a high HDL. So I want to say that out loud, that's very important. Now, obviously, people who do low carb, mainly, besides weight loss, they do it for diabetes, right? And so if you have pre-diabetes, it's in your family history, you're concerned about it, it's almost impossible to be a type 2 diabetic if you do a low carb diet. It's almost impossible. And it's
Mm.
very likely that if you have those things, you're going to reverse the diabetes. And some people don't like the term reverse. I'm going to tell you, you can call it whatever you want, remission, because obviously if you go back to that diet, it's going to come back. So
Mhm.
I'm okay with people that don't like the language of reverse. I wrote my book, Fix Your Diet, Fix Your Diabetes, Your Dietary Solution to Reversing Diabetes. That's how I roll. But I just think that people need to be comfortable with that. And if you're not comfortable, that's okay. But if you want to be in remission, this is a diet for you. Um, the other thing that happens with a lot of people who are afraid of keto in the past, they worry about uh, your um, your LDL, because the conventional doctors will tell you that if your LDL is elevated, that's going to increase risk of heart disease. Now, the first thing you need to hear is that I don't completely agree with that. And in fact, more people have heart attacks with low LDL than with a high LDL. And I've made a
Mm.
complete video talking about why your LDL is a poor predictor of a heart attack. In fact, a better predictor is a fasting insulin level. Even your blood pressure is 2 times more predictive of a future heart attack than the LDL or cholesterol. So let's get that out the way. But what happens with low carb and keto, with that dietary pattern, is that there's the small and large particles. And with this dietary pattern, you increase the large, more buoyant particles that bounce off your arteries. And you decrease the small particles that can get into the crevices and cause heart disease.
Mm.
So this dietary pattern is perfect for reducing your risk for heart disease. And we're talking about heart disease because it's the number one thing that takes us out of this world we live in. So we might as well make sure we do a good job there. So we got that. Then we got to go to the brain, because
Mm.
there's a whole lot of folk who are depressed, anxious, uh, unhappy. And a lot of it is because you're on that. We talked about when we did the podcast together. Alia joined me for my Protecting Your Nest podcast, which comes out next Friday. So make sure you check that out.
Mhm.
That's the audio version, and the video version will follow. And what we find is that we want to have good mental health. And the study that was done by Dr. Georgia E., Dr. Eric Westman, Keto for Refractory Mental Illness, found that people who adopted the keto diet were able to, within, like, before they left the hospital, these are hospitalized people, and they were schizophrenic, they were bipolar, and they were depressed. And 100% had improved symptoms. 96% lost weight if that's something they needed to do. Nearly 50% were off medicines before they left the hospital, or reduced medicine. And another, half were literally just, in remission. Now, imagine somebody with bipolar or schizophrenia
Mhm.
going into remission before they leave the hospital. That's unheard of. And I can't think of one medicine that'll do that. So mental health is my number 7. I'm trying to honor this 10. Okay, so then we go to keto for cancer. And many of
Mm.
you have heard of the Warburg effect. It was such an important principle that the people who discovered that, they ended up getting a Nobel Peace Prize, if I recall. Now, what does that mean? That means that cancer cells favor uh, glucose as their primary fuel. I just ordered a PET scan for a patient last week. And what do we do with a PET scan? We actually give glucose in their blood,
Mm.
and it goes
Mhm.
straight to the cancer. So that tells you right there, cancer cells love glucose. It does not love ketones. So if you're on a keto diet where you have a lot of ketones floating around, cancers tend to struggle to grow. So cancer will be number 8. And I think I'll go to another mental condition, uh, dementia.
Mm.
Dementia is called type 3 diabetes. And people who are poorly metabolically, and poor metabolic health, should I say, those people have a higher rate of dementia, because what happens with dementia, from a metabolic perspective, is that your fuel source, and a lot of people who get this, is primarily glucose. And in that setting, glucose is a horrible substance. If you put it in a factory, it's going to produce a lot of smoke. as opposed to ketones as fuel, which is like a solar panel. So what happens is all that inflammation that your body has to then remove is not done well in people who are at risk for dementia. So if you get rid of that fuel source being glucose and then you convert it to ketones, those people tend to, if you get it early, you can really start the process of reversing that, at the minimum, not allowing it to progress. So that'll be number 9. And then I guess I'll wrap up with another common condition that is beneficial for this dietary pattern, which is hypertension. And what you'll find with most of these conditions is that it's hyperinsulinemia. So if you eat foods that raise and spike your insulin, you will have hyperinsulinemia. And what that means from a hypertension perspective, that leads to insulin resistance, and that leads to you don't make your nitric oxide as well in your arteries, so you constrict instead of relax. And then from in terms of sugar, salt, you will absorb more salt in your kidneys if you have hyperinsulinemia. That'll increase the volume of blood. You'll also cause a lot of inflammation. So people who focus on salt will find that they should be focusing on sugar if they don't want to have hypertension. So I'm gonna go with my top 10, since Alia put the pressure on me. She said, "You gotta give me 10." I'm like, "Can we just talk? Can we just talk?" But she wants me to play doctor, and that's what I did, just to give you guys the top. So thank you for that question, and it's a good way for us to start our live stream today. I love that.
Yeah. Oh, great. Thank you. Since we were talking about triglycerides, I did my blood work a couple weeks ago.
Yes.
And I love to talk about it with the doctor, and I'm not trying to get free medical advice. So no worries.
You're funny.
So
how did it look?
Okay, so the triglyceride. So before, I did it so this was 6 months, and I did it at around 3 months, and they wouldn't let me do my cholesterol because I told them I drank a coffee. I should have just lied.
Yeah.
Because I don't think a coffee with nothing in it but coffee.
It wouldn't have a significant impact. Yeah.
Okay, it wouldn't have a significant impact. Okay, so this time I was better. My triglycerides were 67. That's pretty low. Apparently that's like a healthy 10-year-old.
That's amazing. And what was your HDL?
It was 82.1. Is that good? That's low, right?
Man, that's low, because again, the goal is to have a ratio of less than 2. So if I say 67 divided by 82, I'm gonna try to do that real quick. You get a 0.8. So you're not even a 1. Yeah. So and this is really important, because people who will be told by a doctor who doesn't understand what we're talking about, they will say, well, it doesn't matter because your LDL is high or because your cholesterol is high. And the reality is this is way more predictive of a future heart attack. So Alia's numbers are off the chain perfect, and it would provide a lot of reassurance. Now, what else can she do to make sure that she's healthy? Probably get a coronary artery heart scan. So in our health system, Advocate Health, it's a $50 test. Do you have plaques in your arteries or don't you? Because these tests are great predictors, but they're indirect. If you do a heart scan, we can look at your current age. Do you have plaques? And why you're not my age, but you're catching up. I'm just letting you know you're catching up. But listen, the people I love, my stepdad, my father-in-law, they both had heart attacks in their 50s. I bet you $1 million they were starting to build up plaques in their 40s. So if you get a heart scan, that'll then give you more data. A fasting insulin level will give you more data. Apoprotein beta A ratio, another fancy sounding test, will give you more data. A C-reactive protein, a SET rate, those types of tests will give you more data. But looking at what we have so far, we are celebrating because we want Alia to be available to all of us, sharing her healing message on YouTube, so that other people can be inspired. And she has those beautiful babies and a handsome husband at home, and they expect her to be around. He is not going to raise these babies by himself. So we want to make sure He called me yesterday and told me.
And my husband has no metabolic issues. He doesn't know what it's like to be fat. He can eat whatever he wants, but he's able to moderate. If he wants chocolate, he'll go get a chocolate bar. Not a problem. I get chocolate. I look at chocolate. I'll just get fat. I
Yeah.
think about chocolate and I get fat. Not really, but sometimes you feel that way. But he's never had any of those issues. Next time I get my blood work done, he's going to get his done too. He's not like perfect low carb, but I think he's very close with like his cheats that he doesn't even consider cheating. You know what I
Well,
mean?
you're in the same house because
Yeah,
and so what you're doing is influencing him
yeah,
and the baby. So I think it'll all work out. You
yeah,
don't have to be carnivore.
yeah.
You have to listen to your body. He may be made in such a way that he can do a dietary pattern that's not, where he has plants, but
Oh, he
everybody's
doesn't.
different.
Just fruit. He does fruit.
Oh,
He
he's
doesn't
a
even like
fruit guy.
vegetables. Yeah, he's a fruit guy.
So he's
And but he
okay.
likes his chocolate. He likes his milk and his coffee. But I guess he's carnivore predominantly. We eat like
Pretty much.
predominantly that's how he eats with
So he's
how
like
he
Dr.
wants.
Paul Saladino. He's kind of doing
He can
that.
do it.
He does that.
Yeah.
That's fine. That works. And I just want it to be something that works for him.
Mm-hmm. And
And
I want to say something about my kids,
yes.
specifically my daughter. She's
Mm-hmm.
5. I think she looks like what every child should look like. You can literally see the muscles in her body. Like she looks like a little athlete, and she can be very athletic. She's jumping all over the place, monkey bars. She can swim across our entire pool. I'll be with her, but she doesn't need like the floating devices. Like she's diving. Like she looks very athletic, and I'm like, this is what kids need to be looking like, not even chubby. Maybe I don't know. People are happy when they see chubby kids. She's not skinny and sickly. She looks like perfect. She loves her red meat. She'll eat medium rare meat. She asked me one time, is this cooked? Like, is this raw?
Right.
But I'm like, no, you can eat it. And she likes it. And she loves the fat. And she does really good. She does eat fruit. She eats a lot of fruit. She probably, if she could, she'd eat like 10 bananas in a day, but she's not. Right. She's not overweight,
and
she's not
active.
underweight, and she's so active.
Yeah,
she
she's
rollerblades. She bikes. She's 5. She's rollerblading. She's biking. She's swimming across the pool. She's dancing whenever she hears music. Almost like this is what kids are supposed to be like beautiful, happy children that are the appropriate weight
and mental clarity and able to focus in class.
Yes,
and your daughter. Just for and particularly in communities of color, people, I want the meat to be well done. I want to kill it 3 times. And I say that to say there's secrets in terms of why people can eat, rare, raw steak.
Okay.
And the main thing I tell my patients is the only thing about the steak that's not sterile is the outside. So if you cook the outside of a steak, the inside is actually sterile. That's why all of that red stuff is not going to make you. Otherwise, people would be getting sick all the time.
Right, but don't eat pork that way. Don't eat pork.
Well, right. So you have to think about. But when it comes to a steak, you're good. So as long as the outside was, sterilized through the cooking process, you're pretty good to go. And things like sushi, obviously they keep it at very cold temperatures. That does that works from a different perspective. But so that's why people are able to eat that way. But also eat what you like. Like if you don't like the taste of that, I'm a medium rare guy, and then some people want it more rare. So do what works for you, but just know that when you look at your neighbor sitting next to you, they're not killing themselves. There's some science behind that.
Yeah. Also, we have an air fryer and we make chicken legs, and they love it. And you can make if you get a fatty chicken leg, just toss salt on it, just toss it in the air fryer. It is better than KFC. It's better than Popeyes.
Yes.
It's better. It's so delicious. Just that salt and that fatty chicken leg.
Yeah, the air fryer is a gift. For me, the main thing I like about the air fryer is the fast. It cooks things fairly fast. And I don't have to babysit it. I'm busy. I don't really want to stand. I don't want to have grease popping everywhere. I got things to do. So I think that's something that people need to just be thoughtful about. Listen, If you have I've talked to so many patients who have an air fryer and it's still in the box, or I just haven't used it yet. But once you use it, that's going to be one of your go-tos, and it's very simple to learn. It's not like you have a learning curve. You Google how long to cook a ribeye in an air fryer, and it ends up being 16 minutes, 8 on each side. And just do that for anything you're cooking, or you can look at the book, but that comes with it. But it's so simple. I just want to encourage people to take advantage of this technology if you're busy, and just be comfortable doing that experiment. And so life is so much easier when you have tools in front of you to help you eat the right way. So love that.
Absolutely.
Yes, yes,
I
yes.
have another question that I want to ask you on my blood
Yes.
work, but we have a question from Carnivore Backwoods first.
Yes. Yes.
Dr. Tony, top tips for thriving on the carnivore diet.
Yeah, that's an interesting question. I think the first thing to think about is, do you need to supplement? And if you listen to a lot of people who are in the carnivore space, the people we love and respect, you're going to have different messages, right, coming your way. So the first thing I want to do is talk about, like, do you have to supplement? And the answer is not necessarily. But do I supplement? And the answer is I do. And I did not supplement at first. The things that I tend to take are things like vitamin D, because first of all, I have dark skin, which means I'm going to have a harder time absorbing the sun rays, which will then give me vitamin D from the sun. So I take vitamin D, D3 with K2. The K2 helps to usher the calcium that you're absorbing better with the vitamin D to out of your arteries out of your joints into your bones. The second thing I supplement with is omega-3, because I'm a steak guy, not a fish guy. So I know I don't eat enough seafood, so I take vitamin omega-3, and I tend to take a high, like one that's very potent if as possible. And if you take a high potency omega-3, 1 or 2 of those a day, you should be fine. I have to be careful with electrolytes, magnesium in particular, because I have a very sensitive stomach. I got into this space for irritable bowel. So if I do something with magnesium, I need to be careful not to overdo it. I take Keto Chow's mineral supplement with Dr. Ken Berry's face on the bottle. I have to look at him every day. It drives me crazy. Shout out to Dr. Kim Berry and Nisha Berry. But I take that because when I didn't at first, I probably had been carnivore for 9 months before taking anything, to be honest. I was fine. But I noticed every once in a while I get a cramp. So I decided, you know what? Let me do that. So I started taking that as well. And it also has things like iodine and other stuff in it. So for those who are, who want to add that. But in general, compared to other dietary patterns, your animal-based diet is going to pretty much cover the bases. And you could probably, when they look at people, even when they did the study, there's one large observational study on carnivore that was done. And when they looked at the people who didn't take supplements, they weren't having any scurvy. They weren't having, because you guys are funny when you guys do the keto cookout. Who has scurvy yet? Right? You guys are nuts. But
we have a surprise question for this week.
Oh, okay, cool. Right. Well, that'll be fine. But what you find is that people doing this diet of carnivore, at least, are not getting scurvy. And when they found in that survey of a ton of people, I think it was over 2,000 people, they weren't getting negative effects of. So most people, there were a ton of people who weren't taking supplements. So I think you have to individualize based on what your preferences are. Like if you do eat seafood, you may not need to do that. But I think I would answer that question with that. The other thing is to keep it simple. And I think we all do. That's why we like carnivore, because you just eat meat, right? And maybe some dairy and things like that. But you continue to keep it simple. I think for the sake of your family, if everybody's not doing that, you may want to be open to some alternative things. So Maria Emmerich, she has her cookbooks, but she has a carnivore cookbook one recipe would be her carnivore pasta or lasagna. And you can actually make lasagna without the red sauce. Obviously, you're not using the noodles, and it's a carnivore pasta. So you may want to add variety for your family so they won't look at you like you're aliens as much. They're still going to do it, but that way you can kind of. So I would mix it up a little bit and use those resources so that you can add a little variety to the tolerance. And again, you want to align with what your body can handle. So I'll just kind of wrap it up with that.
Okay, great. So we were talking on your podcast about my heaviest weight, and I will mention it again here. And I will even show a picture. I always show this picture. So sorry, everybody, you're going to see it again.
Dun, 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 dun.
Here
Yeah.
I am.
Oh my God.
225 pounds,
Wow.
maybe 220, something like
Wow.
this. So this is Jacob, and he is maybe a year old, 11 months old. And this is around the time I was diagnosed with my thyroid condition. I was big. Look, there's Chicago in the background. It's Lincoln Park.
Oh, yes, it is. Wow. I see that. Cool.
That's crazy, right? This is maybe some vegetables, like because I did like salads, but not crazy, like a lot of iceberg lettuce. But this is stress and Wendy's. I'm gonna call this stress and Wendy's.
Wow. I mean, it's
And
amazing
other
to
food.
see that transformation. You're still just as happy as you are now, but to see how you've transformed is amazing to see. I had not seen this picture.
It's interesting. It is interesting. So I do have a thyroid condition, and this is around the time it was. Someone says, I can't believe you were obese. Oh, yes, I was. Yes, I was. And a lot of stress with how I looked, more mental stress. Yes, I was happy, but I'm a lot happier now. But the reason I showed that picture so you can get an idea of physically what I looked like. And I remember this one number that the doctor told me about my TSH because he said it was dangerously high.
Mhm.
And I think if I said the TSH was 10,000, is that normal or is that way off? I'm only basing
That's
that
a
based on.
yeah, that probably would be like super, super high because you're the anything over like a little bit over 5
Okay.
is so it would probably now
So it
maybe it
wasn't
was
1,000. It must have been 10,000. I can't
yeah.
find those. I
Right,
went to
right.
Swedish Covenant to look for my
Yeah.
records like online and I couldn't find them. But I do have 2 comparisons of the
Okay.
TSH since then. From starting carnivore, going into
Mhm.
carnivore 3 months in. So, but that's like 6 or 7 years ago. And I want
Okay.
to say I took a little bit of Synthroid. Is that what it's called?
Synthroid, yeah.
Synthroid. It made me feel bad, so I stopped taking it. And when I was pregnant
Mhm.
with my daughter, the doctors convinced me to take some again. So I did. But other than those 2 times, I was on it for very little. I thought that if I take synthetic thyroid hormone, it would just destroy my thyroid even more.
Mhm. Understood.
So that was my thought process. I think my husband gave me that idea, or I read it in a book or something. Anyways, I took it and felt bad. I didn't like how I felt after taking it. So maybe those test results were weird, but so maybe it was 10,000. So May this year, 3 months ish into carnivore, I took my thyroid again because that's the one condition I knew I had. And
Mhm.
it said TSH was, these numbers are crazy. It says I think 51,000, but I think it's supposed to be 5,000 something. I think it's supposed to be 5,100.
Yeah.
So it went from whatever 10,000 ish. This is just from my recollection, but I remember it being, the doctor told me it was dangerously high.
Mm.
So that scared me
Yeah.
into taking the meds.
Yeah, dangerously high is very strong language,
Yeah.
and
I
it
think that's
does
what he said because
yeah,
that rings in my memory.
yeah. I just think that, um, in general, we like these animal-based diets because they have your everything works together when it comes to nutrition, right? Everything kinda works together, so your goal is to do I have all the building blocks for my thyroid to be happy,
Mhm.
for all my hormones to be where they should be? And what happens when you eat meat is that you get all the essential things that your body needs. You get enough iron and zinc and B vitamins and fat soluble vitamins and all of those things really make a huge difference. Obviously,
Mhm.
the better version of it, the better you're going to do.
Right.
Now, but a lot of these conditions have autoimmune etiologies, particularly when you think about Hashimoto's thyroiditis, and it would take some. I don't know if they did the TPO and an
No.
anti-thyroid antibody, and so I would start there. I would say, okay, let's get a reverse T3.
Mm,
Let's get a thyroid antibody. Let's get a TPO, which is one of the antibodies. Let's get a
okay. I
free
mean, they
T.
did T3 and T4, but not the free one.
Right.
Oh, but can I
Well,
just oh, when you're
yeah.
ready, I can tell you the most recent thyroid from a month ago, the beginning of September, the TSH was so it was 5 comma 1, etc. We'll say 5.1, whatever. We'll
Okay.
make it easy. And then this last time it was 4,000 something, the
Oh,
TSH.
wow. Yeah. So that's
So that's
telling
a
you
3-month difference, like
that's,
above.
but so it's almost like your body is kind of normalizing on its own, and you're
Right.
not taking medicine,
No, I'm
correct?
not. I'm
Yeah.
not taking any
And
thyroid
if
medicine.
anybody searches, right, if you just go to
Oh, I
YouTube and
take this.
say,
I take iodine
oh,
sometimes if I
well, there you
remember.
and that's why
Okay.
I take that supplement that I take for the minerals, because 'cause it's got iodine, and iodine is probably a better way to go. Now, again, as we are talking about this, guys, we're
Yeah.
not telling you not to take your
Right.
medicine. What we're
Right.
saying is, let's incorporate lifestyle to see if we can improve things. So, so what I would do, again, it sounds like you're getting better anyway, but Hashimoto's, which is an autoimmune disease, is a good thing to target. So if you find that,
Mhm.
yes, I do have antibodies that would suggest I have that, and I've done my TPO, my thyroid antibodies, my free T4 and T3, my reverse T3, etc., and it suggests that, then we know that this dietary pattern, keto carnivore, is good for you, because there may not be a better dietary pattern for autoimmune disease in general,
Right.
because now you're getting to the root cause. Maybe I had a leaky gut, and my leaky gut allowed me to absorb things I shouldn't, proteins that are
Mm,
large, they shouldn't be absorbed. My body recognizes that as foreign, and maybe some of that foreign stuff looked like my thyroid. So now I'm making antibodies to that foreign stuff and to my thyroid by accident. And but if we get rid of that root cause, the body has a chance to recover and heal. So that's why I think you're doing better. Imagine
mm,
living in a world where doctors say we're going to use maybe a supplement if people, I mean, a medicine temporarily, although you didn't. And then, but in the meantime, we're going to get to why you got sick in the first place. Why do you
mhm.
have, and if we focus on the root cause, that's a better approach than just putting a band-aid on it. Because if you only take the medicine, you never
Right.
got to why it happened. And
Right.
as you can see from your story, Alia, you got better with making changes. So it's like,
Right.
why wouldn't the doctors in this country be trained to think that way, which is what a functional medicine doctor has been trained to do, a chiropractor has been trained to do, and we need to move towards that model. So I'm really happy you were able to get the results you did, because again, a life of pills is okay if you have to do it, but it's better if you don't have to do it.
Right. Yeah, exactly.
Yes.
I agree with that completely. So those are the two things I wanted to ask you about, the cholesterol and the thyroid, and see your thoughts on that. I know I didn't go over all the numbers on the thyroid, but just those, because I remember that TSH being super high before, and that, like you said, the strong language. I believe he said dangerously high, like enough to,
Yeah.
he said something to scare me to go get my medications.
Yeah, dangerously high.
Dangerously
It's
high.
rare that your thyroid test is that off that is dangerously high. That's a strong
Okay, good.
it needs to be adjusted or corrected, but dangerously high is probably a little exaggerated.
A little.
Yeah.
Okay, good. So we have two questions so far. Let's take those carnivore backwards. Dr. Tony, I have a family member who's taking, I don't know what this is, Wegovy, and starting carnivore diet. What's your thoughts and suggestions? First, I don't know what Wegovy is.
Well, first of all, congratulations for pronouncing it right.
Oh,
So Wegovy is the you know how we are in medicine. We discover stuff having seen the impacts of it being used for a different reason. So this is the child of Ozempic, and Ozempic, as you know, is a GLP-1 drug that is very good at reducing your appetite. It's a shot, once a week shot.
Oh,
That's that
okay.
once a week shot. So you get the once a week shot. Now my appetite is gone. I don't even, by the way, everything that Ozempic does, keto does, just so you know. So my appetite is gone. Even the gastric emptying, slowing gastric emptying, keto does that too. So what happens is people who have struggled with their weight, they do really well. It was for diabetes because it tells your body to release insulin only on demand. So the problem with some of these previous diabetic meds, like glipizide, is that they make you release insulin even if you don't need it, which then can lead to hypoglycemia if you're not eating enough carbs, which is why so many people in the medical community say you got to eat your carbs so your sugar won't go down. And I'm like, duh, how about if we don't eat the foods that make your sugar go up, and then you won't have to take the medicine? I mean, so we try to reverse it. Now, going back to Ozempic and Wegovy, if you are on a journey to achieve your health-related goals and you've tried low carb, keto, carnivore, and you can't do it because you're still hungry, which is unusual, but that's your story, or because you uh, uh, just need that extra little thing to support you in that setting, and you've done low carb, keto, or carnivore the right way. You're not eating all the keto products and you're doing it the right way. There may be a place for people to use these drugs. Now, why do I tell people not to use it in the very beginning? Very simple. Number one, because of the potential side effects. Now, if you've had pancreatitis, your risk for pancreatitis is going to be greater on this drug. If you haven't had pancreatitis, it's probably okay. If you are a person who has thyroid issues, as we've just discussed in the family or in yourself, there is a greater risk of thyroid cancer, thyroid tumors with this drug. Number three, there is an issue around, we know that it slows gastric motility, but we don't want to cause gastric paralysis. And one of the things that a diabetic can get is diabetic gastroparesis, which means that the motility of the stomach is not where it should be. So if you take a high-risk person like that, and then you put them on a drug that slows gastric emptying, they may get gastric paralysis. And yes, there are lawsuits pending
Wow.
for people who are suing because their stomach just stopped working. It's very scary. Number four is in Europe, there were over 150 plus reports of increased suicidal thoughts and suicidal ideation and attempts.
Wow.
Now, that's still early, but so if you're a person who's has a history of depression or anxiety, this may not be a good drug for you because now we are increasing your risk that you may take it to the next level. And the one that is the most, well, that's serious, but the one that's really surprising is this ideal of where is the weight loss coming from? And believe it or not, Alia, half the weight loss in the studies they've done so far has come from protein or muscle.
Oh, it's terrible.
That's
terrible.
Think about how horrible that is. So I'm looking at that beautiful picture of you and your baby, and you're trying to hold your baby, but you can't because your muscles give out.
See,
So
but you still got that fat. You still got the fat.
right. So who wants half their weight loss to come from muscle? Now, having said that, if a patient comes to me and they've understood these risks, they've tried keto, low carb, or carnivore, and they've not done well, they've gotten processed food addiction support, maybe with Dr. Joan Iflin and her team. They got coaching. They even got a coach working with them, and they just can't do it. And they don't want, and surgery would be an option. We don't want to do surgery. Then that person, the risk may be worth the benefits. But for anybody checking us out who thinks that Ozempic is a savior or Wegovy, which is a more potent version, that is a farce. And guess what? 70 to 80% of the people in studies who take these meds, they actually regain their weight back. So if you want to be on medicines for the rest of your life, which is what's expected, so you have to take this $1,000 to $1,300 a month drug for the rest of your life, with those potential side effects, that's not the path. Now, if somebody gets on it and they're in my clinic, I will then try to then wean them off with a dietary pattern that will sustain it. Now, if you try to do that drug without changing to a dietary pattern like we're discussing today, it'll probably just lead to weight regain. So that's kind of my 2 cents, a long answer to a short question, but I absolutely am not a fan, but I absolutely do have some patients who take it, and I just give them a very quick, uh, conversation, not in a very demoralizing way, just in a way to say, by the way, did you know? And shockingly, you won't believe this. I'd say more than half those people still say yes to it because people are
Right.
desperate. And
Right.
that's why we're doing this live stream, because we know you're desperate. But if you haven't done what we are suggesting, which is this lifestyle change, you have missed out on a great opportunity. And I just love not being hungry. I have not
Me
eaten. I have
too.
not eaten yet. And I'll probably have something around 1, but I won't have something at 1 because I'm hungry. I'll have something at 1 because it's probably just time to eat. What a great feeling. I
Right,
love it.
right. I love it. On the weekends, it's hard for me because I make breakfast. I don't go straight to work,
Yep.
coming to my office and going to work. So I eat breakfast with my kids. But during the week, it seems more like 11, 12, 1.
Yeah.
And it's
Yeah.
really funny because sometimes I feel extremely hungry. It's like not hunger and then extreme hunger in like a split second. Or I don't feel hungry at all, but I'm like, why do I feel a little off? And
Right.
that's when
That's right.
it's very different than, eating out of boredom or eating for emotions or eating because we eat,
Yeah.
because we're eating, living to eat. It's very different.
And one more thing for this person, carnivore backwoods, which is like so funny to me. I love that title. In the country somewhere, I'm assuming. But I did make a video. So if you search Dr. Tony Hampton Ozempic, I made an animated video with my wife, but then I also made a video talking about warnings, which I think highlight pretty much everything I just told you. Which is why I was able to remember all that stuff. So I would maybe present that to them and say, hey, I support you no matter what you do, but just FYI, this is something you need to be aware
Okay, good. He said one more thing. Thank you, Dr. Tony. I got my family member on the stream to
of.
hear your
Oh,
answer.
that's
Awesome.
excellent.
Wonderful.
Shout out to your family member.
Yeah, exactly. Okay. I hope I say this right. Lucia? I think it's Lucia. Okay. Question: thoughts on stem cell and any research on stem cell and obesity?
First of all, I actually had a guest on my podcast who talked about stem cells for hair growth. And I think so that's another thing you may want to search if you're interested in hair growth, because stem cells are pretty like a natural way to deal with, I just think that it's a good opportunity, just like, probiotics, for example. I think that's a good opportunity. So I haven't done a ton of research, uh, but there are some advances in, in stem cell research that is going to be helpful in terms of help us understanding, can stem cells um, help. And what I've seen in the research is they're trying to say, if we can look at how the stem cells that deal with fat cells, adipocytes, right? Can we modify them in such a way that they are not as inflammatory? They're not as likely to, impact insulin resistance and other metabolic conditions. So again, I don't have a ton of history with looking at that lately, but that's what I'm finding. And I think that stem cell research in general is going to be very helpful because of the nature of it, and how it's likely to be more of a natural way to impact obesity. Obesity is very complicated. So when I was in my obesity training, we talked about, why calories in and calories out don't work. And that's primarily because the same number of calories in different foods have different impacts on your body.
Mm-hmm.
So again, if you use uh, a cupcake analogy with maybe a salad, they may have 300 calories. but the metabolic effect on your body is going to be completely different. So when you're dealing with obesity in general, your goal is to look at the individual and say, where are they being impacted? So if you think about the microbiome, we know that certain types of bacteria like Bacteroides and Firmicutes, Bacteroides may be more favorable, Firmicutes may be less favorable. So maybe one day we'll be able to give you more Bacteroides as a supplement, and it'll help change your microbiome to one more favorable so you won't be overweight, which explains why some people sit at the table with somebody who's thinner. They eat just as much as the larger person eats, and the thinner person doesn't gain a pound. Sometimes it's the bacteria in your gut. Sometimes it's not focusing on calories, but the macronutrient, which is what we focus on. We focus on carbs. And then what we want to do is take the research that's out there. But I'm not aware that we're at a point where we're actually applying this stem cell research to, the general population.
Great, thank you. I want to just read this comment. Not the Anna. Recently was going over my medical history with a nurse. Got to my gallbladder being removed. She goes, all those fatty foods. My response was, no, the opposite, not enough. She said, maybe for you.
Yeah. Well, again, shout out to my nurses and all my clinicians, most of whom only got a high level education around nutrition. When you look at the guidelines for therapeutic carb restriction, and you can present that to the nurse, you'll learn, and you can find that on Low Carb USA's website or the Society of Metabolic Health Practitioners website. Adele Height, who's not with us, who I love to death before she passed, she was the main person who was responsible for these guidelines, and they were written for clinicians like the nurse and the doctors and the advanced practice clinicians. Now, having said that, those guidelines do speak to people with gallbladder issues. And what the guidelines would say is that if a person has issues with their gallbladder not being there, then it is true that there may be initially a smaller tolerance for fat in your diet. And we're talking about keto is a high fat diet, right? Now, what does a person who wants to do keto who has no gallbladder do? Well, first of all, we go back to anatomy and we learn that where's the acids, the biliary acids coming from? Are they coming from the gallbladder? And the answer is they're not. They're coming from the liver. And what happens is, and you also have your pancreas doing some work as well. So what happens is you will then start to adjust. Now, it's nice to have a nice sac with the acids in your gallbladder, which you can squeeze when you eat fatty food. That's a more effective system because you squeeze what you need when you need it. However, the problem with the surgery is that now you have to then have it released from the liver. Now, the liver is going to still do its job and release the acid, so you can still digest fat, right? So you're still going to be able to do it, but it's just and your body has to adjust. So what I tell people with no gallbladder, let's kind of ease into this so that your body has time to adjust. So you can still eat fatty food. You just have to, if you eat you go get a 2 all beef patty, special sauce, lettuce, cheese, pickles, onions. If you do that and you just had your gallbladder, that's going to be a problem because that's a fatty meal, highly processed that your body, but then over time, your body will adjust. This is the irony of all of this. The irony is that when you end up having a gallbladder problem, many times it's because you had a low-fat diet, because you need to keep the gallbladder working. So imagine eating a low-fat diet and you don't have the incentive to release bile because you're not eating that. And all of a sudden it gets sludgy, and that sludginess leads to those stones forming. And after a while, it's just, you got to get rid of the gallbladder because those stones, if they get into the biliary ducts, it's going to block it and cause a lot of pain. So one of the best ways to prevent gallbladder disease and surgery is to actually have a diet that's consistently high in fat. How ironic, but we don't want to have
Right.
the two all beef patties, special sauce, lettuce, cheese, pickles, onions on a sesame bun, because that type of fat combined with the carbs is a problem. But if you
Right.
have an avocado, that type of fat, or that steak, that fat in the steak, then you're okay. So that's kind of how you want to think about this.
Okay, awesome. Yeah, I have some more questions, but I just want to say, she said, I definitely thrive on carnivore without a gallbladder, and I love fatty meats. Crave them, actually.
Woo! I'm
Great
hungry.
news.
I may have to eat after this. Just
Cheeto, keto. Wait, keto, Cheeto. Okay, question. Thoughts? Let me see if I can pronounce this. I don't know what this is. Jardians. What's
You
Jardians?
got it, Jardius. So let me say something about my co-host. She hooked on phonics or something when she was a baby.
No, it's really because learning Spanish, you have to pronounce, everything is always the same. In English, we're all confused. But in Spanish,
Oh.
all the letters sound the same. So I'm trying to apply how to speak Spanish to what I'm reading here.
That
makes
is
sense.
so, but you're doing really good. In fact, I'm gonna call the professor and see if we can get you signed up for medical school.
It's a little too late in my life. Maybe when I'm 60 and my kids are in their 20s, I'll go to medical school.
That'll work. But just so you know, my old dean at West Suburban Hospital in Oak Park, where I trained, she didn't go to medical school until her kids graduated from college.
Oh,
So, and she
wow.
became the dean. So it's never too late. I'm just
Never too
saying.
late.
Just
Okay.
saying. So, Jardius is one of the banes of my existence.
Oh, wow.
And I'm going to tell you why. Because everybody on the planet, particularly my endocrinologists and cardiologists, friends and colleagues, because the medicine seems to be protective against heart disease, they're recommending this drug for everybody. It's in a class called the SGLT2, and that class is known to help you remove the sugar from your blood through your urine. So now the question is, why is it so highly regarded? It's so highly regarded because any drug that doesn't cause hyperinsulinemia, in other words, just like our diet, if you don't force your body to make all of this insulin, which is what glipizide does, which is what insulin does. Now, again, as we talk, please don't stop your medicine. I'm not suggesting that. What I'm saying is the newer drugs, including the GLP-1s, the GLP-1s like Ozempic release insulin on demand. So you never overproduce it, right? Which is better. So that type of drug is good for your heart. Metformin doesn't tell your body to make more insulin. So that's good for your heart. Januvia, which doesn't increase insulin to that degree, is good for your heart. Jardius is the same thing. So when they did studies on this, including the advanced trial, they called it, they had the VA had a trial, a court trial. These trials noticed that when you tightly control people with diabetes with insulin, and you get their A1C into the normal range, like 7 or lower, that's not really normal, but for their purposes, it was. My norm was 5.6 or lower. What they found is that people didn't have amputations, they didn't have blindness, they didn't have kidney disease, but they continued to have heart attack and stroke. And they were like, I don't understand why we control the sugar and we still have heart attack and stroke. The reason why you still have heart attack and stroke is because you're still creating a hyperinsulinemic state. So what we're doing now in this country, instead of spending all our resources on getting coaching and helping people with diet, we're saying instead of not eating the sugar, we're going to say just pee out the sugar. I wonder if that's a good idea. And I have not seen a Jardius commercial because most of my life is on YouTube and things, Netflix, right? But I'm sure if I saw one, they'd have a list of side effects. One would be increased risk of urinary tract infections. One of which would be something called euglycemic ketoacidosis. You've heard of ketoacidosis from for a diabetic who has a high sugar and they have too many ketones, and you don't get nutritional keto acid. There's no such thing as nutritional ketoacidosis. But if you're on a keto or low carb diet or carnivore, and you're also taking Jardiance, you can get this euglycemic, meaning your sugar is normal, but you can still get a acidosis. And that's a problem. So that's why it's the bane of my existence, because you're giving people a medicine that will increase their risk for acidosis, which it should never happen from their diet, but it will happen if they're on this medicine. Now, everybody's not necessarily as concerned as Dr. Hampton, but even with those guidelines for therapeutic carb restriction, if I recall, they may mention that if you're using these medicines, you need to either not use them or use them with caution. So that's something that everybody needs to be aware of. And so those are my thoughts on Jardiance. Don't be surprised if you have risk for heart disease or you have diabetes, they will absolutely put that in front of you. I'm not suggesting that you don't take it. I'm just suggesting you understand that there may be a better approach, which is adopt these lifestyle changes, and then you won't have to worry about these risks that I just described, which really drives me crazy. Let's teach people how to eat well, not how to be on these medicines. And if you look at that medicine for retail, it retails for $400 or $500 a month. And that's a problem because some people just can't afford that. The reduction, I have not looked this up lately, but I bet you if I search Jardiance hemoglobin A1C reduction, I'm going to do it right now just because I'm curious. And if I look that up, you won't believe this. Anybody can do this search in a trial that looked at it. It's also called, it's got a generic name. It only reduced your A1C by 0.8%. In other words, you're at an 8 A1C. You may get down to 7.2 with this medicine, but you're spending $500 a month. And what would be a better way to do this, Alia? How about if we just don't eat the foods that made your sugar go up? I mean, am I really that smart? I'm really not. This is like
you're very smart.
Your babies could probably tell us this just as quickly.
Dr. Hampton, we're at 57 minutes. I want to be conscious of your time, but we do have 3 more questions.
Well,
and I won't take an answer more. Okay, one of them is for me. So it says, what about low carb endometriosis, PCOS? Can you explain a little bit rapidly what endometriosis and PCOS would be and how low carb would affect that?
I'll keep it very simple. They both they're both from inflammation. Endometriosis is when the uterine tissue grows outside the uterus, and it may grow on any other part of the areas in your abdominal area, and it causes a lot of pain, and that pain can lead to pelvic pain, abdominal pain, rectal pain, pain with sex. It's horrible.
Diarrhea.
Go on and say it.
During your cycle.
It's horrible. And so now you're pushing your husband back, and it's not fun. Husbands don't want to be pushed back. Now, and then PCOS, polycystic ovarian syndrome, another inflammation condition. You have cysts growing in your ovaries. It's all from inflammation. It's all from hyperinsulinemia. Again, we did a shout out to Dr. Salcido, I think, during the podcast. And Dr. Salcido, again, is a gynae doctor, conscious gynecologist YouTube channel. I think she has a video about endometriosis and a video about PCOS. PCOS is what I call, it's just like acne. It is it's like the canary in a coal mine. It's the warning. And we're both Chicago folk, so we know about the coal mine at the Museum of Science and Industry. And when that little bird hollers, they're saying, get out of here, because the oxygen level is about to be a problem. This is what this PCOS is going to give you an indication that in a young person, they tend to be overweight. They're going to be at risk for uterine fibroids because that's inflammation. They're going to be at risk for uterine cancer down the road. So the goal is, what causes the hyperinsulinemia? Of course, stress and lack of sleep, things like that do it. But the most obvious cause is too much insulin. So if we then take a PCOS person and don't just put them on metformin, which is what we do in conventional medicine, let's get to the root cause. And the root cause is inflammation. So if I reduce inflammation, I will then literally those cysts, which are from inflammation in the ovaries, will start to shrink away. Oh, by the way, that affects my fertility. Both of these conditions, I just
Mhm.
thought about it, affect your fertility. And Dr.
Right.
Kiltz, who's a previous guest on the podcast, talks about how some of his patients don't even have to worry about his fancy fertility treatments, because once they get on a diet like low carb, keto, or carnivore, it fixes those things. So it's an inflammation problem. The diet fixes it, and now I can have a couple of babies like Alia did, who I met.
Maybe not you, maybe your wife.
You better say it again. Thank God to all the women in the world who help us bring babies into the world. But yeah, absolutely. So that's what that's all about. There's more to learn, but I think watching the videos that Dr. Salcedo on the Conscious Gynecologist YouTube channel would be helpful to kind of lay a foundation of why it's a metabolic condition, both of them.
Yeah, exactly. I want to say that I had no problems with infertility. I got pregnant
Okay.
within a month both times, but I experienced excruciating pain for years.
No
And
fun.
no fun. And I realized doing this that it's unneeded. We just need to eat the right foods and get the right sleep, and our bodies are normal. Women, I don't know whatever your religious beliefs you have, but this is what just came to mind. God did not create women to be tortured every month.
No, no. My wife would agree with that.
However you believe we got here, we weren't created to be tortured on a
No,
monthly basis.
no. We were created, if anything, to help make beautiful babies and to live in harmony with each other, and
Right.
to leave the world better than we found it. So
Yeah,
I'm good with all of
absolutely.
that. Absolutely.
Okay, great.
Mhm.
All right. So like I said, I'm only gonna take two more questions. So we're down to the last two. Uh, this is from Keto Cheeto. No weight loss. Eating too much on clean keto, meat and veggies.
So it sounds like there's some weight loss stall issues. Maybe that's what's going on here. Um, everybody's different. Now, as I look at Keto Cheeto, I'm not sure. He looked like he got some muscles down there lower. So it's possible that when you're making these changes, particularly carnivore, you may find that you're gaining muscle while you're losing fat. That'll stabilize your weight in a way that make you feel like you're not gaining. So I always tell people, we're not going to measure success just with the scale. We're going to measure it with, is my belt buckle loosening
Mhm.
up? Um, and are those metabolic things that we check in the blood, are they better? Do I have mental clarity? Do I feel better? Do you just feel a sense of wellness that you didn't feel before? So I would focus on that. There is no ideal body weight, no matter what you've been told. There is no such thing. Yes, a
I'm so
shocker.
happy that you
Yes,
just said
there
that because I
isn't.
thought I was supposed to be 120
No,
pounds.
and if you go by that, you'll remain disappointed. Even in communities of color, where a lot of my patients are, their BMI at 25, that would even make sense for them. They may, maybe it's a 27, 28, but LeBron James got a BMI of 30. Obviously, he has
Mhm.
more muscle, but
Mhm.
is he obese? Technically, he is, but is he? Okay, that's a silly
Mm.
thing to say, right?
Yeah.
Serena Williams probably has a BMI that's up there, but is she unhealthy? No. So,
No.
so I think getting caught up in that scale is a problem. People do need to drink water. That's very important. And I don't think there's too much clean keto at all. Now, there are people out there, and when I say clean, we're not using all those keto products and low carb products, but there are people out there who believe you need to cycle in and out. That's okay for some people, because it does create a little bit of a challenge to your body. There's mixed messages about should you do that. I tell patients who have issues with processed food addiction not to do that, sugar addiction not to do that, because it's going to trigger them when they're eating things that they normally wouldn't eat. So I think you have to be careful with that. And I do find that people who are not being clean with their keto journey are potentially, think of it this way. I always use this example. So if I get a keto bread that has one net carb, right? And that's in one slice, does that then mean that I can eat 10 of those, which will still be less than 10 carbs, because it's 10 net carbs, but it's really 100 carbs or whatever, some crazy number. It's probably 140, because it's usually 14 to 15 per slice of total carbs. Does your brain logically think that that makes sense, that that's going to be
Mhm.
okay? Based on that methodology, if you're trying to be less than 30 carbs, a day and you go by net, you're probably going to be allowed to eat 30 pieces of bread. Now, if you think that's going to be okay, then I have some land to sell you somewhere. So all I'm saying is use a little common sense, keep it clean, be patient. If you're getting enough sleep, that's important. If you're not, I would fix that. That's why I have a nest: nutrition, exercise, less stress, more sleep, and how we think and all of those things. If you're under a lot of stress, I would fix that. So I would start fixing. That's why I have a nest and a rope acronym. Look at those other aspects of your nest and rope and say, is the rope relationships, avoiding organisms and pollutants, making sure your emotions are okay. Let's look at some of those other factors to determine, are any of those things not in balance? Let's fix those first. And then if you fix those, you'll probably do better.
Great. So we'll take this last one. Somebody else asked a question, but we'll just take this last one. I know we went over this earlier, specific test, but maybe you can answer this again. Answer something similar. Dr. Tony, hypothyroid and carnivore will help being able to potentially go off meds and heal my thyroid function normally.
Yeah, that's tough. I'm gonna tell you why it's tough. If you research it, it'll say absolutely no. If you look at what I've seen anecdotally in clinic, it's a little bit of what happened with our co-hosts, which is things did get better for some of my patients, particularly if their thyroid was just slightly off a little bit, and
He'll be right back.
Oh.
Are you back? Hello, are you back? Please stick.
Okay.
Oh, so we froze for a second.
Yeah, you remember before we started, I said I've had some issues. Thankfully, it happened at the end, so that worked out. Yeah, thank God. So yeah, I got to figure out what's going on with these live streams. But at the end of the day, I've seen a few patients who had borderline low thyroid do really well, and they seem to normalize with the carnivore or keto. Most people, though, seem to improve but not normalize, and what I find is that they take less of the thyroid medicine like Synthroid, but they end up being on it, unfortunately. But what a small price to pay. Like it's just like mental health. If you talk to Dr. Georgia Ede and others who deal with mental health, what they find is that there are a percentage of people who don't have to take medicines. There's a percentage that do, but at the end of the day, we just want you to have a normal, healthy life. So if we can get there, and for some of us, we need the technology of medicine, that's okay. But I would argue that the goal should be, can I function and live in this world, be with my family and feel healthy? And if we need to use technology, like if I break my leg, I will not go home and say, just give me a steak and I'm good. No, that's not enough. Somebody better fix this leg. And then I will use carnivore to help heal it. So I think you want to keep perspective as you move towards achieving our health-related goals. And I would also argue that because of the technology of medications and other things, that has given us a longer life, because some of the things that exist today, something as simple as penicillin that didn't exist, is why we're still here.
Right.
And so be okay with that if that's what you need.
Right. And I agree also, like I wouldn't be able to have my babies, might have been dead if doctors didn't exist, because I had an emergency C-section.
That's right.
And the other one, the head was here. There's no way she's coming out unless
right.
we get a C-section. So doctors have a definite place in this world. And I hope that through what we do, I'm not a doctor yet. Maybe when I'm 60, I'll go to medical school. You know, I hope that what we do, this grassroots movement, we can start educating more and more people and more doctors as well.
Absolutely.
That there's so much that can be handled just by eating a proper human diet.
That's right. And for those checking us out who are new to me, definitely check out the channel. For those who are checking out my channel, new to my beautiful co-host here, check out her channel. I have a link tree, search Dr. Tony Hampton link tree, and it has my handout, which is more low carb keto, I did a great video about carnivore with the Black Carnivore, AJ Fox, if you're getting started there. And I did a great video about how to get started with low carb, which is also in that link tree. So check that out. Keep thriving. As a Russ of the home sick Buckeye channel, grooving, moving, steadily improving. Let's keep doing this great work. I'm really loving the opportunity. I'm actually about to go prepare I go to Keto Palooza, and I need to get some slides together. So I'm going to spend my afternoon preparing some slides for that, which will be in Kentucky next weekend. So looking forward to that. Yes, absolutely.
If there's ever something in Chicago, maybe I'll come home.
Amen. Well, we're gonna work. Dr. Kim Berry keeps insisting that we create something, and maybe that'll happen.
Wonderful.
So absolutely.
Awesome. All right. Thank you again. Thank you so much for having me on your podcast, and that'll be up soon. And thank you so much for coming here. And I hope we can do this again.
We will. Have a great day. Enjoy your family, and nice seeing you. Thanks, guys.
Nice seeing you too. Bye, everybody.